Now, it begs the question then, what percentage would you say of women in the US have hormonal imbalances?
I would. So there are times in a woman's life when hormone imbalance is normal, and
Hmm.
there's a lot of my colleagues on the internet that kind of bash, well, me and other providers that talk about hormone imbalances because they're saying it doesn't really exist. Well, we know it exists. What they're hitting on is that it could be normal. So things like menarche, when women start having their periods, menopause, pregnancy, certain times in the cycle, hormones are imbalanced, and that's normal. They're supposed to be imbalanced. However, when I find that when it becomes a problem, and I always ask this question, are these symptoms that you're having interfering with the way that you want to live your life? And if they are, then that to me is a hormone imbalance that probably should be addressed. So women that actually have what I would consider abnormal hormone imbalances probably are around the 70th percentile, because what happens is, one, they get brushed off by the medical community. They're told they're too young to have a hormone imbalance, or they're getting older and that's normal, or they have their labs drawn and they're told that their labs are normal. And I would challenge anybody listening, when you get your labs back and you have a doctor that tells you that your hormones are normal, that's like saying you're inside the house. Okay. So you're in the house, but what if you're laying on the floor in the basement? That may not feel as good as being on the main floor. So I always want to know where they are in the house. And I can tell you, because I've seen it thousands of times, moving somebody from the basement to the main floor, they're still in the normal range, but they feel a lot better. And that's where I think we're losing the narrative here, is that we're so black and white in this field of hormones that we just don't listen also to the symptoms. Patients will tell you if they don't feel right. I put women on hormones sometimes and they'll come back 4 weeks later and say they don't feel any different. And we'll draw blood again. And it's because the cream that I put them on, just for whatever reason, isn't absorbing through their skin. So we'll switch them to a sublingual. So you always have to be willing to adapt and change, and everybody's individual. And sometimes you got to do things differently for many different people.